As of 8 a.m. Thursday the 21st of October, there have been 874 PCR tests across the islands. Of these, there are 28 positive tests from the community, and this includes 6 children. Both of the people admitted to hospital remain stable, and neither of the people is in need of the support of a ventilator. A number of people are presenting to healthcare, whether it be to the flu clinic or to the general practitioners' clinics, who turn out to have COVID-19 disease, but their symptoms are mild and they're being managed in isolation at home. 111,027 COVID-19 vaccinations have been given altogether. 55,991 of these are first doses, representing 79% of the estimated population. 53,684 people have had their second dose, which completes the course, and that represents 75% of the population. 1,352 people, which represents 7% of those over 50, have had a third or booster dose.
When I see people on social media saying that COVID is not real, it makes me so very angry. As a nurse, I'm like, how dare you just shadow me one day, just one day, just an hour. Walk around this unit and see what you see, and you will know that COVID is real.
I think sometimes it's easy for people that are sitting on the comfort of their own couch, posting on social media about why the vaccine isn't good for you. That's what I find truly frustrating, because we are in here and we're seeing it every day. We're watching people die.
I understand that people have certain reservations about the vaccines, but you see hospitals full of COVID patients. You don't see hospitals full of patients that are sick because of the vaccine.
We've been keeping track of our deaths that have been happening in our ICUs, and 100% of these deaths are in the unvaccinated individuals.
My father died in April. He was scheduled to get his vaccine the day he was admitted into the hospital, but they didn't have enough back in March. There are vaccines at every store, at every corner, and I'm taking care of people every day who make that choice to not be vaccinated. Don't let your families go through that pain. That pain is something that rips our hearts out every time we have to put your family member in a body bag, and then having to do it to our own family who would have done anything to be vaccinated but couldn't be.
I have been an ICU nurse for 16 years, and I have zipped up more body bags from March of last year to this point than I have in my career. When you are zipping up body bags for two 30-year-olds within 48 hours of one another, you don't get over that.
Scientists all over the world are coming to recognize that this is a war that is going to be with us for a while, especially I think living in Florida with our current vaccination rates. This is a war that's we're going to have to continue to fight, and our best defense against the virus is still vaccination.
I want to say thank you to Tampa General Hospital here in Florida for that video. Frontline healthcare workers who are certainly taking care of patients and are seeing things unfold with their own eyes, sharing their experiences, and really appreciate you taking the time to join us on tonight's CMR COVID Spotlight. And, we're about to check in with private providers in the Cayman Islands, trying to find out how they're preparing. United States has lots of hospitals, lots of support, and they're able to pull on each other as cases started to really pick on up. And the Cayman Islands, we've been pretty much in that bubble for quite some time. And so we want to see exactly how the Cayman Islands is preparing. Tonight's show, we're going to focus on private providers. On Tuesday, we're going to have the Health Services Authority, HSA, on to talk about how the Cayman Islands Hospital is preparing. And so I want to welcome to the show, we have Dr. Francisco Martinez from Integra Healthcare, We have Dr. Doily Solomon from Doctors Hospital, as well as Dr. Binoy from Health City, Cayman Islands. So Sandra is in the background. She's going to be pulling up some of your comments. If you have any questions, please do write it in the chat, and we'll certainly get your questions answered, as well as if you have any questions for the doctors and you want to ask your questions directly, you could also do so. You'll see on the bottom of the screen sometime coming up in the near future, you'll see the ability to type in that URL. You'll have to use that HTTPS : // and again, you'll be able to ask your questions live if you wish to do it that way instead of typing it in the chat. So Sandra, are we able to pull up our doctors, our guests for tonight? Okay, perfect. So I believe Dr. Solomon might not be on at this time, but Dr. Martinez, how are you tonight?
Very good. How are you doing, Kevin?
Wonderful. Well, I'm going to start with you first, Dr. Martinez, and just kind of let everyone know, for those who might not know you, would you please tell us a little bit about yourself and who you work for, and go from there.
Okay, and I am a GP. I work at Integra Healthcare. I am from Spain, from Madrid. I came to Ireland 9 years ago, and I love it so much that I stay here. I come from the background of working in the main military hospital back in Madrid. So also when we had that pandemic of the avian flu, I was in emergency at that time. I spent also a year and a half in a hospital in Norfolk, England, working in A&E, and now I'm doing general practice here on Ireland.
All right. Well, thank you, and really appreciate you taking the time to come on. And Dr. Binoy from Health City, Cayman Islands, would like to share with our audience a little bit about you. You'll have to unmute first, sir. I believe you're still muted.
Hi. Thank you, Kevin. Good evening, and definitely thank you for bringing into this show. I'm Dr. Binoy Chattuparambil. I'm a cardiovascular and thoracic surgeon at Health City, Cayman Islands, also the clinical director. I am here for the last 8 years. I came from India, where I worked as a surgeon for the last 21 years. And here we are now.
Thank you very much. And I don't think Dr. Solomon is on yet, but he'll definitely, we'll have him join us, and once he joins. But, I want to kind of start off with a very important question. What have you been doing, Dr. Martinez, to start to prepare for an increase in positive patients? We know not all of them might require hospitalization, but at some point in time, if someone tests positive, they might end up coming to your clinic or one of the other clinics around the island. So what are some of the things you're doing in your clinic, and what are you hearing from your peers on how they're preparing as well?
Okay, one of the very important things that happened on island at the beginning of the pandemic is that all the doctors that normally we didn't connect each other, from HSA, from Health City, from Doctor Hospital, from private clinics, we created a chat group in WhatsApp called COVID-19. Since then, that group has been always active. So since we are thinking in opening borders, and with the recent start of community cases a couple of months ago, there has been a lot of information being passed between each other, what is really interesting. At the clinic, we had been creating a protocol to be able to separate people who could have COVID from people that comes to the clinic for other reasons. We are lucky of having a clinic that is big enough to do it and has to access. So one of the things we do is that if someone has flu symptoms, we ask them to stay in the parking, and we take the patient directly to the doctor without stopping in the front desk or in the waiting area. Another thing we did at the beginning of the pandemic, and we keep it, we never change it, is to hire a full-time cleaner for the clinic. We used to have the typical person coming in the evenings to clean, and now we have a full-time person cleaning. So she's actively disinfecting, sanitizing the chairs, the counters, the desk, constantly, the toilets. Of course, we wear masks since we started with the pandemic, and we try to maintain all the recommendations that come from either public health or from the Health Practice Commission.
And what about you, Dr. Binoy, at the Health Study Cayman Islands? Of course, we know you're not really a clinic. You guys are a hospital setting, so it's going to be a little different in your environment, I'm sure. But what is being done to prepare for COVID-positive patients?
Yeah, Kevin, now at this time of this year, I mean, it's almost 18 months after this pandemic started. We are totally different stage now comparing when we had our first COVID-19 case. At that time, we were all very vulnerable to the virus because nobody had any vaccination, and I mean, like any other virus, new virus, we were all vulnerable. Now we are totally at different stage where nearly 80% of our adult population are vaccinated. So our situation is different from what we were at that point of time. So we are not that worried now that how much even though there is community spread is there, the number of patients, the number of people who are going to get admitted to the hospital or seeking any ICU care, I don't think we are not that worried now compared to 1.5 years ago. In spite of that, we should not take things light because we have seen what happened to many other countries also. We have learned from other countries. So we are also prepared very well, and it's a multi-pronged approach. We cannot say that this will work and this is not enough. First of all, we are part of a national COVID-19 strategy committee where from government hospital, other private practitioners, everybody is included. And it was constituted at the beginning of this pandemic, and it's still going on. So every time then a new situation comes, new variant comes, new treatment comes, we are all sitting together and making the guidelines, updating the guidelines. So that is the very important part of this the strategy, because it is evolving. The virus is the way it is affecting, and the treatment that is coming out, the vaccination, and the testing also, actually it's all evolving. So we are updating that. So most important thing is the strategy. Then other thing is the manpower, whether we have the adequate manpower or not. So we are getting the right personnel to train the manpower what we have, and keeping a backup of manpower. Actually, if a situation comes, whether we can bring in enough manpower, whether they need testing for the lab, whether we have nursing manpower, we have the doctors, and if the doctors also get the infection, where we have the backup doctors and nurses. So that is the another preparation that we are doing. The third one is the equipments. Again, we are not expecting that we will require a lot of ventilators or that kind of oxygen supply, all those things, but still we have maximized our capacity for these equipments. Our ventilator, we have 21 ventilators in the hospital, and we have the other equipments like if somebody not able to make their or not able to sustain their oxygen level even with the maximum ventilator capacity, then they have to go with the artificial system like ECMO. That's some of these very important, very complex system, and only ours is the second in the entire Caribbean. We have that facility. We have 3 such machines. So at any different stages of this treatment, if somebody is not responding, we can gear up actually. If somebody needs only oxygen, we have oxygen. If somebody needs ventilator, we have ventilators. If that also fails, we have the most advanced technology to keep them alive with this extracorporeal membrane oxygenator. So that is a third approach, that keeping our machines and equipments that we need to treat these patients at different stages. Other one is supplies. It's very important actually. We have heard about this supply problem in other countries. So when we say supplies, it is PPE, that is very important. Adequate number of PPEs we should anticipate, and we should have pile up our inventory. So instead of 30 days, usually we keep inventory, we made it 45 days, and we have very good network of vendors and the supply chain all over the world. So anytime if we need more, we can get in within a few days. And the new medicines also coming, at the different stages of this development of this pandemic, different medicines. So we are also keeping all these new medicines that is available in the market with us. We may not require, but we are keeping adequate stock of that, and the backup also we have. And then other thing is, you must have heard about the new strategies coming about this testing actually. So about this enhancing the testing capabilities. Like initially we had this PCR, now it's lateral flow is approved. So we have brought that also to the island, like in few other institutions. So these are the approaches. It's a multi-pronged approach we are using. If a situation comes, how we can manage and how we can cope up with this yeah, the situation comes. So we are prepared very well actually to treat if that situation comes.
Do appreciate you going through some of that, and we'll dive into some of those things because there was a lot of different things that you mentioned in that. But one of the things that I would definitely want to ask is, if you talked about looking at staffing and making sure you have the ability to get in staff. But I also do know, especially here in the States, and I know it was the same thing in other parts of the world, in the Caribbean and throughout the world, that there is a staffing shortage in medical staff. How do you expect to manage that? And what is being done right now to ensure that you don't run into problems should you have, let's say, an outbreak in your facility and you lose a portion of your staff? What's being done in order to be able to support that possible need?
Yeah, that's a very important and very interesting question actually. See, that is, we have again heard and we have learned from other countries and other hospitals. The manpower is very difficult situation to handle, especially in this pandemic, because this wearing this PP, this coverall, and working for 6 hours, it's very difficult. So we need additional manpower if that situation comes. So what we have done is, we have first of all trained our entire staff here how to manage the patients. If, because you know that usually the ICU trained nurses, if they are there, it's a limited number of nurses actually. They can manage patients in a ICU who are on ventilator. But what we have done over the last few months, we have given training to the nurses so that any nurses in health city can treat patients in the ICU, even on ventilator. And the over the last 6 months, whoever new nurses who we brought here are all trained in ICU care. So that is one. So existing staff, we are upgrading them by training to treat patients at any stages of this disease or the treatment. Second, the most important, if a situation comes and there is a acute or severe shortage of staff, not only at health city, even on the island, we are ready to bring staff in a matter of few days if the government wants. Because back in India, we have a system where we have more than 20,000 employees, and the nursing, most important, the nursing manpower. That's what the shortage usually happens. So if that situation comes, in a matter of few days, we can bring enough nurses to the island actually to tide over that situation. Not only for Health City, for the island I am talking about. So I don't think we should worry about this manpower crisis if that kind of surge happens with this pandemic.
And Dr. Martinez, I guess you have a much smaller amount of staff members, and so again, if a couple of them are out because of getting COVID or testing positive for COVID, or even being exposed with a direct contact, I'm not sure how you guys would handle that, but maybe you could share some of the plans that you guys have probably discussed already.
Okay, of course, we don't have the staff that a hospital has, no? It's impossible. The staffing problem through people really sick, I don't expect it with the vaccination, okay? In my clinic, everybody is vaccinated. We are starting with the boosters. So I don't expect my staff to get really sick with the COVID. Another question is to be positive, no? Once they are positive, depending on the country situation, because has happened in many other countries, we will need to follow what public health says, no, about staff. If I have a staff member or myself who is positive, and the first thing is to isolate and contact public health. They will tell us what is the next step to do, when can we come back to work again, and that will depend on the pressure on the system. That I don't expect it, because as Dr. Binoy said before, no, I think we closed the door to one pandemic last year in 2020 that was terrible with no vaccines. We were lucky enough to be away from that pandemic. We didn't go through it. And we are going to open the door to a different pandemic. A pandemic with a 79% of people vaccinated with a vaccine that we are seeing that prevents severe disease, reduce admission to the hospital, reduce mortality. So the scenario that probably we are going to see when we open the door, let's say the borders, is going to be different. And I expect something very different of what we saw in the news or what our colleagues back in Europe during 2020 were seeing, no? That was really terrible. I think we passed the worst without being there, and I expect we will do really good with massive vaccination.
Well, we do have still uncomfortable size of the population in the Cayman Islands that are not yet fully vaccinated. And so they're going to be, as we know, the most vulnerable.
Yes.
We do know if you're fully vaccinated does not mean you're completely immune, but it significantly lowers the chance of hospitalization or death. But we still have a noticeable population that are not yet vaccinated. And so we can likely, if we're going to be planning for worst case scenario, there could certainly be a surge of patients, and a surge could certainly impact a hospital system. You said, Dr. Binoy, that you have some ECMO devices as well as ventilators. We do know Health Services Authority has some, but let's say that we have, unfortunately, a worst case scenario. How are you guys all working together as a health system with your private practice, with your other hospitals in the Cayman Islands and the Health Services Authority? Let's walk us through some of those conversations that you have as you're planning, should there be a worst case scenario. And Dr. Binoy, I'll have you start off on that one.
Yeah, this is one situation. I am very glad to say that the government, the public health, the government hospital, and the private practitioners, including the private hospitals, all together worked as one, actually. And since the beginning until now, government and the government hospital, public health taking the lead role, and we are all supporting. We are all part of that team, and it is working very well. I would really like to appreciate and thank the way public health is doing this, the management of this public health, including the vaccination program, including the testing and tracing and everything. Is an amazing job public health is done for this keeping us all safe. And HSA is taking a lead role in all aspects of this diagnostics and therapeutic aspects, and we are all actively supporting and all together. So very collaborative and collective way actually this came together from the government, whether it is government, public health, government hospital, private hospitals, and private practitioners. So I am very glad to see that everybody fighting together this pandemic, and that's what we are seeing actually the result also. We are so safe country.
And Sandra, why don't you take a look at the comments? I see we do have some questions coming in, and as she's about to pop on, I just want to make sure I invite everyone once again who are watching to please just take 3 to 5 seconds and hit the share button to share it with others. And if you have WhatsApp, go ahead and please WhatsApp people and let them know that we are having this conversation, because we want people to be very comfortable. We're moving into a new phase in the not so distant future, and so we want to make sure people are reassured of this information that we're sharing. So again, take just a few seconds, hit the share button. We would really appreciate that. And Sandra, what do we have going on in the comments?
Wonderful. We've got Rachel, who has a question. Rachel wishes to know, do the hospitals of Cayman have enough trained staff and specialist respiratory care and ventilation? And what if these staff get sick?
Dr. Martinez, you want to take that first, and then I'll ask Dr. Binoy right after.
I don't work for the Georgetown Hospital, but in these days, as Dr. Binoy said, we have been in very close contact. No? We have been working in groups, in the same group, someone from HSA, someone from Health City, a private doctor. So I think they have, and they are training, and there is a very updated protocol that everybody has been working on it with the last treatments to give to the patients. And now we are enrolling everybody who hasn't got an updated advanced cardiac life support training. Practically the whole community of doctors are enrolling in the new training courses that will happen at HSA. So I think if something bad happens that I don't expect it, all of us will be there helping, I'm pretty sure. Either at Health City, either at Georgetown Hospital, wherever is needed, we will go there to help if it is needed, but I don't expect it, luckily, okay? So, and I think HSA has a staff qualified to give a good service to people with respiratory problems, and of course, Health City too, no?
And then from Health City's perspective, Dr. Binoy?
Yeah, we do have a respiratory specialist, Dr. Pulmonologist, Dr. Archita, who is actively taking part in this strategies, what is making guidelines and everything that is developing on the island. And we have the respiratory therapist also. And as I told you, the nurses. So that part, we are very, very strong as a hospital and as a country. And the second part of the question was about what happened if one staff gets positive. This we have gone through that situation in the beginning, and we have proved that that is nothing to worry. We can tackle very well. Actually, basically, we have to follow the protocols like aggressive testing and tracing and isolation. That's what we did in the beginning. A few of our nurses turned out to be positive at that time, but still we could avoid any outbreak in the hospital or in the community. So we have that protocols in place, and even if somebody tested positive, now we can contain that virus very well with our protocols. That's in place.
Sandra, what else do we have in there? Sandra? Well, I do have another question that I do see as well. What about the vaccination? I know Dr. Martinez talked about his staff being fully vaccinated. What about at Health City? Are you guys requiring that, and all staff at Health City fully vaccinated?
No, not all staff. Everybody in the clinical side are vaccinated, 100% vaccination in the clinical areas. But in the non-clinical areas, a few of them are still not vaccinated. Actually, we could reduce that number significantly after giving motivational talks and scientific evidences and all that still going on. So still a few of them are, I should say again, it's not in the clinical area, it's in the non-clinical areas. But they are all going through the weekly PCR tests. So that will make sure that they are not carrying the virus and the entire hospital is safe.
Okay. And I do have a question on sanitation protocols. What's being done to ensure that sanitation protocols or what is the sanitation protocols? Like what's being done in the hospital at Cayman at Health City Cayman Islands?
Yeah, it's very standard protocols again existing for this sanitation. It starts from the patient or visitor or the doctors comes to the hospital till they leave the premise actually. So when somebody comes, first they'll get tested by the temperature. That's an automatic machine is there. It's a sensor that will tell whether they have the temperature, and it is connected to computer. So if anybody has the temperature beyond normal, it will give alarm so that immediately they will be this is why I'm talking about the any visitors or patients coming to the hospital. They will be that alarm comes immediately. They will be taken to the different room where they will be isolated, and from there all the samples and further investigations will be taken care in that isolation room, and till the report comes, the PCR report comes, they will be isolated. Now, and coming to the patients who are coming in the emergency rooms or for coming for procedures, also will have to go through all those protocols. Like anybody comes for a procedure, they will have to do for the PCR test within the last 72 hours. Anybody comes to the emergency till they are getting the PCR test, they will not be moved out of that area. That is one part, that is about the testing and making sure that they are safe. The other part is, as you said, about the sanitization. So every rooms in the inpatients area, once the patients come and they leave that room, every part of the room actually, the including the bed linen, the patients the clothes, whatever is coming out of the room, everything is going through a separate corridor and getting treated differently. That is for if somebody is when this is what I was talking about when the patients were positive actually that time. That is long ago. But now also we are following the very strict protocol, cleaning and getting the rooms and equipments ready for the next patient. Every instrument, every equipment, and the room and the furniture, everything is getting cleaned and getting ready for the next patient. So it's absolutely safe, and we are having that very infection control committee, hospital infection committee that laid out the protocols how to do the sanitation programs, and we are following that. So it is all very standard protocols that's followed by even the clinics or the hospitals, and it is very well accepted. And if you stick to that protocols, I don't think we have to worry to come to the hospital for any treatment.
And what about how are you keeping your patients safe as they come in and out? Because you don't know who might or might not be COVID positive. As people are coming in and out, do you guys have chairs blocked off in certain areas, or how's that managed?
Yeah, that's what I told Kevin. One is that entry point, we are checking the temperature, and we are making them clean their hands with sanitizer. These are mandated, and we are asking them questions, actually questionnaire, whether you are symptomatic or not, any fever, any cough. If any of those things are there, definitely we'll take them to a different route. And second thing is about the social distancing. So unlike before, pre-pandemic, we have that our lobby and all that is very spaced. The chairs are very less now. It is all in accordance with the social distancing, and it is mandatory that everybody should wear a face mask while they are inside the hospital. So these are the measures we are doing, and with this, definitely we can make sure that the people who are coming inside are uh, virus inside.
And Dr. Martinez, what about you? I know you kind of touched on it a little earlier, but as people and
Yeah.
patients are coming in and out, how are you guys managing that at your clinic?
We are very lucky. I'm very lucky to work with the people I work, because all the doctors, including myself from my clinic, we come from hospitals. So we have spent our lives working in hospitals. Hospitals, infection control is something that we have in the DNA, you know. So for us, washing hands, sanitizing, cleaning, maintaining everything ready to be used and totally disinfected is part of our life, no? All of us has 25, 30 years experience, no? The cleaning and everything is, as Dr. Binoy said, is not something very different of what we used to do for other infections, no, that can affect patients. So what we are doing, of course, we have at the entry a control point, and if someone shows, and they know because there is a sign, symptoms of having something similar to a flu, they wait, as I said before, they wait in the parking lot until the nurse calls him. Then the nurse goes there, brings the patient, crosses the clinic, enters the doctor's room without sitting anywhere else, without touching front desk. And we are also lucky of having a good amount of lateral flow tests, so we can even, if we suspect it inside the room, we can have an idea of if it is a or not, and the patient can leave. Almost we know through the lateral flow test if we are dealing with a COVID patient, so we call public health, we tell them we are sending this person for PCR, or if it is a negative. So we maintain, and also I said, we have a cleaner, so a patient comes to my room. After the patient leaves, the cleaner comes inside with the typical sanitizer spray, sprays everything, bed, desk, chairs. We are constantly washing hands. So I think during, for people who is in the medical field, the washing hands and sanitizing is a bit different than from other people, no? That comes from places probably you never need to wash your hands, and when you access to the TV before, no? And sanitize your hands. For me, every time I see a patient, a new patient, now and 20 years ago, I have to wash my hands, apply sanitizer, and so I think we can feel pretty safe in the clinics, no? Probably, I'm going to say something that I tell to some of my patients, no? Probably now a clinic is safer than could be a supermarket, or because we have protocols, no? Or a bar, or a place you stand up chatting with friends, no? Because we have people paying attention to everything that happens in the environment inside the clinic. So we don't allow people to stay together. We have rules for accompaniment. So I think it's a pretty safe environment, like could be any of the hospitals. And we are vaccinated. Again, I know there is a group of people who are not. it's a game changer. We have the vaccine, but it's a game changer for this.
Absolutely. Everyone saw the video in the beginning of the show where, these are people who work in the hospital settings who are telling you those who are passing away, those who are filling the hospitals are unvaccinated. And I know some people say, well, how do you know they're vaccinated? Well, I could tell you when you go to the hospital, and I was actually hospitalized a couple months ago. And one of the first questions that I was asked was, are you vaccinated? So it's by talking to your patients, first of all, but as well as at least the Cayman Islands, I don't think have this system for private providers, but at least in the United States and in the state of Florida where I live, there's something called Florida Shots. And private providers have access to vaccination records because something like the COVID vaccine is required to be uploaded to their vaccination record. And private providers do have access to it. So whether or not a patient gives that information or not, it is available for a doctor who is going to be treating a hospitalized patient. So I know some people were saying, how do you know? Well, that's how you know. But I do have a question about telemedicine. Are you guys exploring the potentials of telemedicine? I'll start off with you, Dr. Martinez.
Yes, we have been with the telemedicines again since the pandemic started, that we have that lockdown period that we could practically only do telemedicine. And we have all the equipment to do telemedicine, our camera, like the one I'm using now, for this. Of course, there are cases, again, that if you come to me or you call me and you tell me I have a chest pain, I can ask you several questions, but there is a point that I need my stethoscope, listen to your heart, I need to do an ECG, and maybe call Dr. Binoy, So, or an abdominal pain. So there are things that unfortunately are dangerous through telemedicine. And this is why you need to have the clinic prepared to see some people like we did last year in 2020. We were doing 80% telemedicine, but there is always a percentage of people that is impossible. You can miss an appendicitis, a heart attack. So yes, we are ready for the telemedicine, and I'm very lucky because I was in the military hospital that had a department of telemedicine since 2000. So I had been seeing the telemedicine for 21 years. But this is Cayman Island, so I mean, the distance is short. We need telemedicine only when a patient is very sick to move, or in a pandemic. If not, there is nothing like the face-to-face with the doctor, the information that provides.
Dr. Binoy, what about Health City Cayman Islands?
Yeah, we are also going into this way, actually, telemedicine. But as Dr. Martinez told, not all patients can be interviewed or treated or examined by telemedicine, but we can definitely reduce the crowd in the hospital by encouraging more people to come on a virtual platform, because if we have seen a patient in the before and follow-up patients, those patients we can definitely manage by this telemedicine or this virtual platforms. That the importance is that will significantly reduce the crowd in the hospital, whether it's in the lobby or in the outpatients or those areas. So we should improve, overall in every hospitals or any clinics should improve the capacity to do this telemedicine or those virtual platforms. That will definitely help reducing the crowd in the hospital. And it's once you have seen the patients, like for me, at least if surgeons, if you operate, we have to see them maybe at least a couple of times in the post-operative period. Those times we can definitely meet them by a video call, ask them, see the wound also through the video call. Okay, so that can avoid their visit to the hospital. That will definitely help them, help us also, and help all of us actually by reducing the crowd in the hospital. So we should encourage more and more on this telemedicine consults.
Absolutely. And I know some patients sometimes just prefer it, especially if it's nothing serious, but you just need to talk to a doctor. It's a
Exactly.
convenience thing. Yes, the Cayman Islands is small, but we do have traffic, and we just have people with very busy lives as
Yeah.
well, who sometimes could just benefit from that discussion, that access to a physician.
Correct.
Yes, all the time that you can practice telemedicine in a safe way to the patient is fantastic, no? Because the patient doesn't need to move from his office or from his home, but has to be safe, no? So that we keep
Very true.
a proper examination of the patient. There has been cases in the UK that the coroner of Manchester has said, "Hey, be careful because sometimes can be difficult." No.
So, got a quick question. Are there plans to offer the COVID vaccine at your either clinic or hospital? I'll start off with you, Dr. Binoy. Is there going to be any move in that direction to the best of your knowledge?
See, as far as I know, public health is doing an excellent job in this vaccination program. They have done over this last maybe 8 months. So I do not see any reason why we should do. But if they need any support, if they need any help to improve the vaccination program, we are always there to help them. But I think they have done a great job in vaccinating this country, almost 80% of the adult population. So, but if I have not heard any move towards that, but if that support is needed from Health City, we are always there to help them.
And are you going to be willing to do that too, Dr. Martinez?
Definitely, definitely.
Willing, I will be helping if it is needed. No, I think like Dr. Binoy said, public health has done a fantastic job organizing the vaccinations. I think we are modelic. No, I am from a different country. I have been living in another different country. I can tell you what I have seen here is really good, no? In terms of how the vaccination program has been developed, given to the people. So I don't see a reason to take over public health in that. Another thing is that public health tells local doctors, okay, we cannot do it anymore, we are overwhelmed, we need help, then we will help in whatever is needed, of course.
Well, I got a comment on that because I am in public health, but in Florida, and the way we do public health here is a little different. And I just want maybe to offer a suggestion based on my experience here in Florida. The goal is to also encourage a lot of people to get vaccinated. Now, if you have an opportunity when you're talking to a patient face to face, and the patient is now convinced because of your one-on-one interaction with the patient, okay, I'll go ahead and get vaccinated. Trying your absolute best to make sure that that actually happens is definitely, and some people are just more comfortable going to a doctor that they are comfortable and familiar with. So it's one of those things that could be used as a strategy to really break into some of those who have chosen not to get vaccinated. Breaking down that barrier, because when you go to necessarily a public location, you might be like, I don't know this doctor. I don't want this person touching me. There's a lot of people out there that absolutely hate vaccines, but yet if they have that relationship with their physician, that can make a world of a difference. And so I'm just want to offer that suggestion. I know at least here in public health in the state of Florida, we don't want to have any type of barriers. In fact, we've partnered with certain pharmacies who are willing to go to the homes of people to vaccinate them within their own home, because some people just need that, especially those who are parents and have children who will make a humongous scene because they don't want a vaccine. Eventually, we know younger children aren't eligible yet, but there may be a time that that's going to be a thing. It's just more comfortable. So that's just some feedback that I want to share. And we have made significant strides here at least for some of the unvaccinated population, we still have a lot more to go. Cayman is way, way ahead of us in the state of Florida in the United States. But at the same time, we do have a very noticeable population, and I wanted to make sure to at least highlight that to consider if that opportunity does arise.
I think, sorry, I was interrupting. I think the people that we still have unvaccinated in Cayman is people that they don't want the vaccine. It's not that they didn't have access or it was inconvenient to go to the place because it was so easy to get a vaccine. We are a small country. It takes you 15 minutes to drive to a vaccination place, and the waiting time was minimal. And everybody has been collaborating. I know people, many patients, no employer has said to them, don't go to the vaccine, you are in working hours. So the sociology, demographics also has an influx, no?
Mm-hmm.
Maybe being a small country with a different mentality too, I think we have been so successful because of that. You always find through the fake news that are very accessible now through YouTube, Facebook, everything, this number of people that are really difficult to convince, really difficult. I tried with several of them. And you can spend 1 hour, probably Dr. Binoy, that is smiling, had the same experience. You can spend an hour and you go nowhere. It's almost impossible, no?
Yeah. But you don't want to give up on them either. It's like someone that is diabetic, but they won't give up the things we know causes diabetes to get worse. You don't want to give up on them. And if you have an opportunity, I know it's a physician's job to always do whatever you can to encourage the health and well-being of that patient.
Okay, we do have a few questions from audience members. So Rachel wants to know how many of your staff members are hospitalized, are vaccinated. Do you guys have any stats on your vaccination rate within your own facilities? Is there anyone that isn't vaccinated, and do you have an internal policy that's governing how you're handling that?
Yeah.
Okay, we have all clinical staff and admin staff vaccinated, apart from one admin staff that is in the back office and is leaving the clinic in the next month. So I can say anyone you face in my clinic when you access is vaccinated. Anyone that tells you, hello, how you doing?
Okay, Dr. Binoy?
Yeah, actually, we also have a few employees not vaccinated yet, but they are not in the clinical area. In the clinical side, 100% vaccinated. These are in the non-clinical areas. But I don't know exactly what the number, but it's not a very big percentage at all. And the motivational talks and our doctors taking class and taking all their questions and giving the answers. So that brought down the number significantly down, actually, because this is what I wanted to tell Kevin, what you told. Actually, when these talks do help, initially I thought they are all very strongly against vaccination, but when we talk to them, especially when you have some good relation with your staff, and you can convince them, actually this is whatever their fears or whatever their apprehensions, we can convince them. So definitely we have still a few staff, but we are it's a mandatory, they have to go through weekly PCR test, and they are doing that.
Okay, very good. Rachel also agrees with Dr. Francisco. This was quite a few minutes ago, but she said that, yes, this is a different pandemic for us because we have the vaccine and much more information about how to care for COVID patients. But she's also wondering, since COVID is airborne and aerosols can float in the air for several hours, especially in closed spaces, what can you tell us about the ventilation in your respective facilities or hospitals?
Well, I've been moving that because it's true, ventilation is super important. Remember, I come from a country that the pandemic was terrible in Spain, no? It started in February when nobody has these numbers and killed it massively. we ventilate the clinic every evening. So every evening, again, we are lucky of having a back door in the opposite side of the front door. So when we open both, there is even in Cayman a nice breeze inside the clinic. So we keep the clinic ventilating easily every evening for 2-3 hours, okay?
Do you guys have air filters as well too, or is it just natural air that you guys have?
Natural air. We have no filters.
Dr. Binoy, I guess the same question.
Yeah, so what we are doing is, there is every hourly there is a particular number of cycles. The air exchange should be there. So if I am right, it's I think around 6 cycles per hour. The cycle should change. The air should change. We have increased that to 9 cycles. That is just to keep on changing the airs, the environment, the air that is there inside the rooms or inside the corridors. So we have increased that air cycles per hour. That is to reduce the chance this virus in the air is there that can be moved out of the rooms or the corridors. That's what is the recommended actually.
Okay, very good. We do have another question from Rachel. She says, what happens if people don't have sufficient insurance coverage to pay for specialist COVID treatment?
In my case, of course, I'm a clinic. I don't admit patients in my clinic, no, but I have never left a patient with no treatment because he cannot pay for the treatment. I can only say that. Okay.
Yeah, that's true. It's true with us also. Never deny treatment for anybody.
Treatment.
Very good. Burrell wants to know if we have any monoclonal antibodies on island to be given as soon as vulnerable persons have a breakthrough infection.
I heard they are working on it. In the last committee I was.
Yeah, we are getting our monoclonal antibody batch early next week. There was a global scarcity of these monoclonal antibodies. We tried hard, but finally we are getting, maybe in a few days, we will have our monoclonal antibodies with Health City.
Yeah, and I could give some background on that, at least in the state of Florida. This is one of the monoclonal antibody treatments that is showing a lot of success. The issue is every one of these doses that were ever made was purchased by the U.S. government to be used in the United States of America. So this one happens to be a little easier because the one that Dr. Binoy is talking about is given through IV therapy. This could be given through injections in 2 arms and 2 sides of your stomach. So this one is a lot easier to be given. However, there is a shortage because some countries that have larger pockets are able to buy it all.
Yeah, and the other thing is that it's very expensive also. So we cannot keep a big inventory of these monoclonal antibodies, and we don't expect actually that kind of need. But still, we are keeping a reasonable good number of the doses available with Health City. If that situation anybody on the island needs, we are ready to give monoclonal antibodies.
And we need to remember, it's very difficult to compare countries. No, we need to remember where we are. We are in a 70,000 people population, small island in the middle of the Caribbean. So maybe we have the engine of a Ferrari, but outside we are still a Honda. No, we don't have the power that can have the United States, the France, Germany, Spain, with 70 million people. I think we are very good for what we are. Really good, really good.
And at the same time, we still want to make sure that we have in case we need it. So.
Yeah, and that will certainly be, I guess, the biggest question mark is, Cayman has always been resource rich, but of course the question will become at some point, will the system be inundated depending on what happens with the infection rate? And I think that that's a possibility that people need to keep in the back of their minds, because much bigger countries with more resources have certainly seen them stretched to the brinks. So Charlene, good evening. She says, what advice would you give to residents with central AC units in their homes, especially if an occupant is tested positive with COVID? And they can't open the windows.
And they can open, they can't. I will say to keep a good service of the AC, to keep the filters clean, and maybe you can leave the shoes when you access the home, leave it at the door. And but I don't see that is going to create a lot of COVID, no, in the household, and mainly again in a household that everybody is vaccinated. I come back always to the same, no, vaccine is the solution, or the only solution that we have now.
I'm not sure if Dr. Francisco's having an issue with his connection. Oh, there we go. There we are.
Okay. Could you hear me or not?
No, I think part of you got cut off from me. Did you hear that, Kevin?
I did hear everything.
Okay.
Your connection, because I know your
internet
is kind of intermittent.
Yes. Okay. All right. Katie is also joining us. Katie says a friend of hers who's a teacher is wondering why teachers in general are not included now that older immunocompromised people can get the booster shot. So teachers feeling that they're at particular risk, that they should be clumped together, like the healthcare workers, anyone who's immunocompromised. Of course, now the age has been dropped to 50. Anyone 15 over is also eligible for the booster vaccine.
And for that, we'll definitely bring that on Tuesday's show when we're on with HSA and the Minister of Health and those who have the ability to create those policies.
Yeah.
So,
but it's a good idea. From my point of view, it's a good idea.
Final question, Charlene says regarding antibody testing, do you foresee it becoming a necessary process in the near future with all the various variants that are now following COVID-19? Antibody testing.
Are you guys doing that at Health City, antibody testing?
Yeah, we have actually. We brought from the beginning, but not many takers actually for the antibody testing. So we have the kits available, but I don't see much interest in among the public to see what is their antibody levels.
We have access to antibody levels. We can order, but the literature tells you that still we don't know what is the good level of antibodies. Even you can see someone who has a titer of 0, but to make it simple, we have two types of immunity, one mediated by antibodies and another one mediated by cells. With the antibodies, we are only testing, supposedly, because they have many false and positives and negatives, part of the immunity. We cannot test how is the cellular immunity. There is a memory cell immunity that can be there, can protect you, and we cannot measure. We cannot say how it is, no? So
yeah, and even though the antibody level is low, when your body is encountering this virus, the memory cells will activate and they will fight with this virus. So antibody titer alone will not tell us actually your resistance power.
Okay, well, thank you so much. That's all the viewer questions that we have.
Thank you very much.
Thank you for inviting us.
Andra.
No problem. Really appreciate you guys. But just before we go, just some final comments from each of you. We could start off with Dr. Binoy.
Yeah, we are very safe with this 80% vaccination rate, and we have to encourage all those 20%. I mean, most of them are the children, but whoever is not vaccinated, as a physician, doctor, it's our responsibility to encourage those people who are coming across to get vaccinated, as that is the only tool that we have as of now to prevent this infection.
Thank you. And Dr. Martinez.
I agree with Dr. Binoy. We are very safe because of the vaccination rate is very high, and also because we have seen during the whole pandemic in Cayman that the people follow rules. People in general follow the rules, and it's what is creating problems now in Europe, no? People not following the rules. We saw the people in general, 95% of the population following the rules of public health, and this is super important. that the people listen to public health, follow the rules, use the mask when they recommend it, sanitize the hands, and remember, even if the vaccine is not 100%, it's the only thing we have. And if you are vaccinated, probably you are not going to visit the hospital with COVID. And you will not visit the cemetery with COVID.
All right. Well, really appreciate you all taking the time to share with everyone what you guys are doing at the places you worked at. I believe we got a message from Dr. Solomon, who was supposed to be on, that he actually had to go to the hospital to deal with some things, so was unable to join. But again, thank you for joining. And Sandra, want to stick around just for a quick little chat?
Okay, sounds good.
All right. Thank you, doctors.
Thank you.
Thank you for both.
Good night.
Thank you. So, Sandra, we have coming up on Tuesday HSA that will be coming on. That's going to be an exciting show.
Yep, sounds good. No, I'm really looking forward to that one, actually, because I think these discussions now is kind of bringing it back locally when we're talking about, the private facilities, as you had on tonight, the HSA, obviously, for Tuesday's program, because people want to know, on the heel of us potentially reopening, we're going to get that announcement tomorrow at 1 p.m. with the press briefing. People really want to know what the position is, where we're at. So just FYI, tomorrow morning, we will actually be doing the show from location a little bit, because we have both the governor and the premier that will be getting their booster shots at the vaccination clinic in the morning.
That's funny, because I'm getting my booster shot tomorrow too.
Oh, that must be a good sign.
It must be a good sign. And a couple of my neighbors actually decided to get their booster shot at the same time. I'm getting my booster and my flu shot at the same time tomorrow afternoon.
Okay, wonderful.
So, and then of course, we did check in with Caymanians living abroad, kind of letting people know kind of how they're able to live with COVID.
Mm-hmm.
And so we're going to be airing that within the next couple of days, I believe, Sandra. We'll let everyone know when we're going to air that.
Definitely.
So really appreciate everyone, taking the time to join us tonight. And I hope you all have a wonderful night.
Good night, Ken.
Good night.